friends, welcome back to Agape Vlogs. This is continuation of NMC CBT Test 5 Part 1 from questions 31 to 40. And I also advise each one of you while going through the questions to note down your score so that towards the end you can know your status. And also please do comment in the comment box your date of exams and your locations so that I will keep you all in my mind and in my prayers. You are definitely a part of me and my family. Okay, so let's begin with the question answers. So friends, I know all of you are here to train yourself to appear for CBT exam, and as part of the training I would like to boost your confidence by sharing pictures of a few of our subscribers who have cleared their CBT the last weeks. So don't forget to congratulate them, and tomorrow you will definitely be in their place. Somebody is going to congratulate you as well. Okay, so guys, are you ready to congratulate Rowena Dias from Caribbean island, Trinidad, West India? So congratulations Rowena Dias, and a blessed career ahead. Also, let us congratulate Jincy Elizabeth Verghese from India who has cleared a CBT at Oman. Congratulations Jincy, have a blessed future, have a graceful career ahead. Next, congratulations Jitendra Parma who has cleared his NMC CBT exams from India. He is also another rocking subscriber of Agape Vlogs. He used to play my audios while he used to go for morning walks, and that is really truly appreciable of you, Jitendra. And you know, the other subscriber who I have mentioned earlier, that's Rowena, that's Rove Diaz, she also has mentioned that she used to play my audios daily in the morning and until she goes to bed. And you know, these comments make me so honored. Thank you guys. And also the new subscribers, please continue to listen to the vlogs very religiously, and definitely you are going to clear your CBT exams. Now let's start with question number 31. When should a penile sheath be considered as a means of managing incontinence? Options are: option A, when other methods of continence management have failed. Option B, following the removal of a catheter. Option C, when the patient has a small or retracted penis. And option D, when a patient requests it. So the right option is when other methods of incontinence management have failed. So that's the right answer. That is option A is the right answer. And I guess all of you know the penile sheaths are used by male patients who are suffering from urinary incontinence. And penile sheaths are often referred to as condom catheters or external catheters or uridoms. So that's it. Now let's move on to question number 32. What is the most important guiding principle when choosing the correct size of catheter? Options are: option A, the biggest size tolerable. Option B, the smallest size necessary. Option C, the potential length of use of the catheter. And option D, the build of the patient. Option B, that is the smallest size necessary, is the right answer. That is option B is the right answer. Hope you got it right. Question number 33. When carrying out a catheterization, on which patients would you use anesthetic lubricating gel prior to catheter insertion? Options are: option A, male patients to aid passage as the catheter is longer. Option B, female patients as there is an absence of lubricating glands in the female urethra unlike the male urethra. And option C, male and female patients require anesthetic lubricating gel. And option D, the use of anesthetic lubricating gel is not advised due to potential adverse reactions. So which one did you pick as a right option? Option C? Yes, you're right. Option C, that is male and female patients require anesthetic lubricating gel, is the right answer. Okay, so when carrying out a catheterization, anesthetic lubricating gel prior to catheter insertion is applicable or required by male and female patients. Okay, bear it in mind. Okay. Question number 34. On removing your patient's catheter, what should you encourage your patient to do? Options are: option A, rest and drink 2 to 3 liters of fluid per day. Option B, rest and drink in excess of 5 liters of fluid per day. Option C, exercise and drink 2 to 3 liters of fluid per day. And option D, exercise and drink the normal amount of fluid intake. So what would you advise your patient on removing catheter? You would definitely encourage the patient to exercise and drink 2 to 3 liters of fluid per day. So that's the right answer. Option C is the right answer. Okay. Question number 35. What are the principles of positioning a urine drainage bag? Option A, above the level of the bladder to improve visibility and access for the health professional. Option B, above the level of the bladder to avoid contact with the floor. Option C, below the level of the patient's bladder to reduce backflow of urine. And option D, where the patient finds it most comfortable. So, what is a principle you would follow to position a urine drainage bag? The right answer would be option C, that is below the level of the patient's bladder to reduce backflow of urine. Option C is the right answer. Okay, let's move on to question number 36. What are the principles of communicating with a patient with delirium? Options are: option A, use short statements and close questions in a well-lit, quiet, familiar environment. Option B, use short statements and open questions in a well-lit, quiet, familiar environment. Option C, write down all questions for the patient to refer back to. And option D, communicate only through the family using short statements and closed questions. So, what is the principle of communicating with the patient with delirium? Come on, what's the right answer? Right answer is option A, that is use short statements and closed questions in a well-lit, quiet and familiar environment. So, option A is the right answer. Okay. So, what is delirium? It's a sudden and severe change in brain function that causes a person to appear confused or disoriented, or to have difficulties maintaining focus, thinking clearly, and remembering recent events, typically with a fluctuating course. So, how do you handle a delirium patient? It's always you have to provide a calm and quiet environment. That is in the answer, it is like that. So, you should keep inside lighting appropriate for the time of day, and you have to plan for interrupted periods of sleep, because the delirium patients, they don't have enough sleep even, and it is often associated with sometimes with after surgery, or with alcohol withdrawal, or dementia, etc. So you should plan for uninterrupted periods of sleep at night, and you should help delirium patient keep a regular daytime schedule and encourage self-care and activity during the day. Okay, so that's it. So now let's move on to the next question. Question number 37. Which of the following is not an example of non-verbal communication? Options are dress, option B, facial expression, option C, posture, option D, tone. So in this, the right answer will be option D, that is tone. Non-verbal communication is the transmission of messages or signals through a non-verbal platform, such as eye contact, facial expressions, gestures, posture, and the distance between two individuals. So in this, the right answer is tone. I know all of you have got it right. So let's move on to the next question. This session, the questions are rather easy, so I want all of you to get 10% correct. So question number 38 is: which of these is an example of an open question? Options are: option A, are you feeling better today? Option B, when you said you are hurt, what do you mean? And option C, can you tell me what is concerning you? Option D, is that what you are looking for? So all our questions, there are open questions and closed questions. So which of these is an example of an open question is the question here. So which one did you get it right? Option B, that is when you said you are hurt, what do you mean, is the open question here. Okay. So what is an open question? Open question is something that cannot be answered with a simple yes or no. It rather requires a long answer. So we are coming across a closed question in the one of the prior questions in this session itself. Hope you remember, in a patient with delirium, we are supposed to ask close questions only. Okay, that we don't require long answer from a patient with delirium. So there we came across the closed question, and here we have come across an open question. So open question is something which cannot be answered with an yes or no. Okay, so now we are moving to the 39th question, and I also have a simple request. That's, if you do like my vlog, please show it by giving me a thumbs up. Okay, 39th question is, according to Arrigal 1988, when two people communicate, what percentage of what is communicated is actually in the words spoken? Option A is 90%, option B is 50%, and option C is 23%, and option D is 7%. What is the right answer? Option D, 7% is the right answer. Okay. So moving ahead on the question itself, you probably might have heard of 7-38-55 rule of communication. Have you? In that, a social philosopher named Michael Argyle, who lived in the 20th century, he passed away in 2002, and in the year 1988 he had come to the conclusion that while a communication happens, only 55% of the total communication is delivered by body language, 38% by vocal signals, and the last slim 7% is delivered by words. So isn't it interesting? So you have got the answer also here. According to Argyle's rule, when two people communicate, the percentage of words spoken will be 7%. Okay, that's how we got a 7%. Because he says only 7% is delivered by words. So just don't forget the 7-38-55 rule. Okay. So friends, we have reached the last question. So before going to the question, I would like to thank you all for the valuable comments you have been posting. They have been very encouraging. And also so many comments, success comments have been popping up right now also. I would like to share your pictures, if you don't mind, in the next vlog. So you can forward your pictures and location to agapeallovejesus@gmail.com. So let's go ahead with the question. What factors are essential in demonstrating supportive communication to patients? Option A, listening, clarifying the concerns and feelings of the patient using open questions. Option B, listening, clarifying the physical needs of the patient using closed questions. Option C, listening, clarifying the physical needs of the patient using open questions. And option 4, listening, reflecting back the patient's concern and providing a solution. So this is really confusing, right? But if you really go deep and check, you can find the right answer. The right answer is option A, that is listening, clarifying the concerns and feelings of the patient using open questions. So we already know what is open question, and so this is the right answer. So friends, thank you all for listening to my vlogs, for subscribing. Some of you still haven't subscribed but are continuing to listen to my vlogs. I really thank each one of you and wish everyone a grand success in the forthcoming exams. Stay tuned and stay safe. Okay, bye-bye. Take care.